My name is Steve Vander Waal. I'm a practicing internist, board certified. I grew up in a small town in Iowa, and when I came out to the coast for the first time, I fell in love with it and signed on the dotted line immediately, and I've been here ever since. I've practiced on the coast here in Manzanita, Seaside, and Gearhart for 27 years. I've been bicycling really since 1976. I was a resident at Michigan State at that time, and I could just hop on my bike and take off whenever I had a few free minutes to get out and exercise. I got more serious about it about 20 years ago, and I've been riding about 200 miles a week, at least during the spring, summer, and fall months. And during the winter months, I put it up on a trainer when it gets too dark to ride and ride in the garage. I like to ride out on Highway 53, which is a country road out through the mountains on the Coast Range, and there's not much traffic out there on the weekends, and it's a good way to get away from things and have a nice quiet ride. It keeps me feeling good. There's the endorphins, I guess, that are produced when you bicycle or exercise regularly. It burns lots of calories. I can eat anything I want to and still keep my weight down. The speed aspect is nice too. When you're going down those mountains at 40 miles an hour, that's a lot of fun. So it's just a healthy activity that makes me feel good. I love the intellectual challenge in medicine. I love being able to work through problems with people, to help decipher what their symptoms are, what kind of problems they're having, make a diagnosis, and then come up with a treatment plan. That's a lot of fun. It's a real challenge to do that, and it's real satisfying to be able to hopefully give them advice of how they can live better and healthier lives. It is a challenge to provide care for Oregon health plan patients. The financial system that the state's in right now, the allocations sometimes prevent you from doing what you would like to do for patients, but at least for most of them you can get the basics done. I think CareOregon is probably better than most because they are much more responsive, I think, to the average practitioner. We do get a representative that comes out here on a frequent basis and discusses things with our staff, and there's some personal connections established, and if there are problems or things that they can address, they're certainly willing to take suggestions. I haven't had that experience with the other insurance companies, so that's been a positive thing. The fact that we get a representative that's over here on a regular basis helps a lot. A lot of these patients have a lot of needs, and sometimes it's helpful to have a representative you can talk to. You need to try to get some of these problems sorted out, find some solutions.